Welcome back to SA Live. Well, February isn't just the month of love. February is also National Heart Month. Are you doing everything you can to keep that heart healthy? Joining us now is Dr. Rowland Reyna, founder of HealthTexas, to give us a few pointers on how to pull that off. Hey there.
Hey, Fiona, how are you?
All right, let's talk about the main risk factors of coronary heart disease.
Probably the most important one is a family history for early heart disease. If somebody first took your relative in your family had heart disease, get checked, get aggressively treated. Diabetes is one of the leading causes of death in heart disease in San Antonio, particularly. If you're diabetic, get your diabetes under control. For many people, if they lose weight, get down to an ideal weight, the diabetes will go away. High blood pressure, high cholesterol. As we get older, that's a bigger risk for heart disease. Being a man is a bigger risk for heart disease. Smoking is terrible. Absolutely quit smoking. If you've had prior heart disease, you're at higher risk. Of course, people who are obese and people who have sedentary lifestyles. Those are really the biggest risk factors.
What are some other natural ways of decreasing the risk of coronary artery disease?
The bottom line is that increased risk and diabetes and sedentary lifestyle causes an inflammatory effect in the body. And it's the inflammatory effect is what causes the blockages of the arteries. So anything we can do to lower inflammation is what works. Exercising is probably the most important thing you can do. When people exercise, they actually lower the risk of heart disease and cancer and Alzheimer's. They lower markers of inflammation. So exercising 45 minutes, 4 or 5 times a week is probably the most important thing. Getting close to an ideal weight, as we said before, losing weight, again, lowers inflammation. Supplements can be very effective. People who take vitamin D3, anywhere from 2,000 to 5,000 units, talk to your doctor about it, and Google this yourself. But people who take vitamin D lower the risk of heart disease. People who have vitamin D deficiencies, and most of us do, have a 40% higher risk of having a heart attack and stroke. Pharmaceutical grade fish oil, it has to be pharmaceutical grade, lowers markers of inflammation. Great stuff. CoQ10, resveratrol, turmeric. Actually drinking a little bit of wine a day. And of course, control your blood pressure, diabetes, and cholesterol.
All great advice. So if someone has a family history of heart disease, high blood pressure, high cholesterol, should they get the COVID-19 vaccine?
As we get older, there's a higher risk for getting COVID. As we are more obese, if we have lung disease, anything that affects your immune system. These are things that significantly increase your risk of COVID. So the bottom line, actually, and I tell this to everybody over the age of 16 should be getting the COVID vaccine. If we develop what's referred to as herd immunity, where when you get 60 to 75%, nobody knows the exact answer. But if most of us get immunized with COVID, we will stop this dead in its tracks. This COVID will have no reservoir to go to. So get your vaccine, everybody, please. It's extremely important. They're extremely safe. The new one is particularly promising as well. So exercise, lose weight, take care of your diabetes, and get the vaccine.
Dr. Rowland Reyna from HealthTexas, thank you so much for your time and for that advice. HealthTexas has 17 convenient neighborhood locations in San Antonio, Bernie, and New Braunfels. For more information, just call 210-731-HTMG. That's 210-731-4864 or visit healthtexas.org.